So I'm here to talk to you guys about Florida. I know we've talked a lot about investing, we've talked about data, we've talked about the security, the ancillary services that make your business work. But when you're planning for your business success, the data that underpins that is what's ultimately going to determine whether your performance is successful or not. So what we're going to do is we're going to cover just a very brief update. What is Florida looking like? You guys have heard a lot of perspectives from a lot of different experts. Why do we think the Florida market will grow the way it will? Once that we've discussed that information, we're going to talk a little bit about what that means for our projections and ultimately what that means for your business. And then we'll end with thinking about how these sort of dynamics will play out in Florida and then what ultimately that means for your decision making. So when you look on the slide, you see that right now we've talked a lot about the vertical integration requirements. We've talked about what makes Florida's an attractive medical marijuana market. We see that Florida's growth, currently projected based off of what we've seen from other markets that have similar regulatory frameworks, is going to make it one of the biggest markets in the country. We see demographics, socioeconomics. We see a lot of the information pointing towards strong market growth. But what could change that? When we think about the overall marketplace, these are our numbers around projecting the total market size over the next 7 years. Now, we've done a lot of iterations and statistical analysis when we're trying to envision how this market will evolve. What's ultimately very important and what I'll discuss towards the end of the conversation is what's still left unsaid. Will flower be allowed? Are they going to remove the vertical integration requirement? How are they going to manage dispensary licensure applications? Will those increase over time? Our understanding is that when you think about the ability of delivery services, the ability to reach these patient populations, this is going to be a fast-growing market, almost 50% compounded annual growth year on year. Now, while there's some pre-existing infrastructure that will allow this onset to begin quickly, there's also going to be elements that we need to figure out, and this is the uncertainty and the risk that everyone's discussed. How do you manage that risk? What you're seeing on the slide in front of you is essentially only meant to impress you with the number of quantitative data savvy points that we're presenting. These are the patient adoption over time trends that we've seen from month one of dispensary sales from every single marketplace that's existed in legal cannabis. So what do you make of this information? How do we start to draw insights out of what we've seen from other markets? What we've seen in Florida is physicians have the ability to prescribe for any debilitating condition currently, similar to what we've seen in the District of Columbia and Massachusetts. We've seen the single biggest determinant of medical market participation be the inclusion of chronic pain. Chronic pain, you can go in for any real condition, and we've seen that increase patient participation by almost 3,000% when markets do include that haven't previously. So when you're looking at the chart in front of you, this is what we see from DC and from Massachusetts, the two most similar regulatory frameworks to Florida's current iteration. This is what we're basing our growth projections off of, and this is why we constantly reiterate from New Frontier's perspective every couple of months how the market is performing. What will this mean for our growth projections? Ultimately, that's why we're all here. This is going to be a marketplace. What's your position in it? How do you ride this rising tide of growth for your business performance? How do you raise money using this information? How do you allocate your resources using this information? Maybe you need a larger grow. Maybe you need to target a different segment of the customer and patient base. This information is why we exist as a company. So I alluded to this a little bit at the beginning of the conversation. What does Florida's market dynamics look like? We see simultaneously factors that would contribute to higher growth, while we also see simultaneously factors that would inhibit growth. So when we look right now, our view is it tends to skew more towards a higher market growth opportunity currently. We think delivery services will be a boon for industry growth. Being able to go to a hospice and deliver to 200 patients simultaneously will increase consumer and patient access. But when we think about the supply that we saw on the third slide, currently there's only 7 licensed and only about 4 licenses that are actually operating and producing right now. So when we think about the market growth, you see at the text at the top of the slide, ultimately that's the main question that's left unsaid. How will flower shake out? We've seen flower, I know the gentlemen on the previous panel were alluding to almost 50% of sales in Colorado, a very mature adult use market. But that trend is true across all medical markets. We see flower start predominantly as the majority share of product, and that shifts over time towards what we see as concentrates, edibles, all types of topicals, creams, et cetera. Those related types of products will continue to gain share over time. So how do you plan for that? We've worked with companies that are applying for licensure. They want to know, what does my consumer slash patient base look like? What are the demographics? What is the cancer incidence rates? What's the disease prevalence rates by county? How can we target our potential customers better using this data and business intelligence? And that's exactly what we do. As a company, our goal is to provide you the business intelligence you need to power your operational and strategic planning. More than anything, I know I'm standing between the reception and all of you. We've had a long day for everybody. The drinks are coming, but we are here now to understand why this is an opportunity. That is our entire existence of a company. We want to be able to tell you, here's how you fit into the overall pie. They talked about a smaller piece of a larger pie. Well, I can go back a couple slides. This pie is growing rapidly. This pie is just being baked. The ingredients are coming together. People are meeting in Tallahassee. They want to try to define how this market growth is going to look. So this is why it's so beneficial, and a big thank you to Carlos and Tom and the rest of the FCC team for throwing this event, because all of you are the stakeholders that will determine the trajectory. How do you get involved? Why do you get involved? This is the marketplace in front of you. All of you guys and women are going to be the pioneers that do trailblaze this growth. How can you do it best? How do you optimize your product inventory? Do you know what your patients want? How do you establish your business? Where do you establish your business? How do you think about navigating these regulations? These are all the questions that we like to specialize in, and that's a focus of my personal career, our company's mission. We want to bring accountable, responsible, and transparent growth to cannabis. We believe that's the best way to grow the industry, and we hope you join us in doing that. Please